anatomy and physiology students. We are now about to embark upon our latest topic, which is the articulations, also known as joints, where bone meets bone. We know our skeletal system has got to have bones linked to one another. Having joints is going to create mobility and allow stability. I kind of did that backwards from the way it's written on the screen, but no worries. It's correct either way. Okay, so let's talk about some different ways we can classify articulations. Bones joined together. So, if we're talking structure, there are three ways we can categorize or classify joints. And those three ways are fibrous joints, cartilaginous joints, and synovial joints. And basically what I like to do here is think about what's between the bones. Okay? So obviously when I have a joint, I have two bones uniting, right? So like for example here are a pair of lumbar vertebrae. You should know that they're lumbar vertebrae, of course. And this is a joint between the two bodies of the lumbar vertebrae. So this right here is a joint. Well, if we look at what's in between the bones there, we'll notice that it's this pad of fibrocartilage. This is fibrocartilage right here. So if there is cartilage between the two bones in a joint, well, logically it's going to make sense that that is a cartilaginous joint. All right. Over here I have a skull. You should be able to recognize all these bones and many of these things that we see here. I want to take a moment to look at this joint here between my temporal bone and my parietal bone. It's a lovely joint right here. In this case, there is nothing but collagen linking the space between these two bones. It really isn't even a space. It's just collagen stitching these two bones together. And if it is collagen that is providing the connection between the two bones, well, you notice I've avoided using a word here, collagen what? Collagen fibers, right? And so this right here, all of these guys, all of these sutures, they are going to be fibrous joints. Lastly, I got the elbow joint down here. Nice elbow joint. In between the bones, we're going to have fluid, and the fluid that we have is known as synovial fluid. Okay, so you knew this already, but this is going to be an example of a synovial joint. So these are my three basic types of joints in terms of their structure. Hey, by the way, you know what you should do right now? You should pause this video and try and point out all the stuff on this lateral skull and all the stuff on these lumbar vertebrae, and if you can, some of the stuff down here as well. So give yourself a little lab quiz like right now. Highly recommended. All right. Another way we can do it is we can classify joints in terms of their function. Your textbook uses a variety of big words to describe the functional joint classifications, but I am just going to give you three basic ideas here with some easy to understand words, okay? Joints can either be not at all movable. I forgot the word all there, didn't I? Check that out. I'm going to write that in. Put a little caret there and say not at all movable. That's one category, not at all movable. So think about the sutures in your skull, this coronal suture right here. You're not moving that thing. That is an immovable joint, not at all movable. Now on the flip side, there's definitely movable joints, like quite movable. Elbow. Yeah. Humero-ulnar joint. That's definitely movable. Then there's the ones that are like, meh, a little bit. And the intervertebral disc, in this case, that joint between the two bodies of the vertebrae, it's kind of movable, a little bit. But not as much as your elbow or your shoulder. Okay, so this is our functional classification. Now, as you probably guessed, what we can do is we can combine these and see if we can make combinations. Like, are there going to be fibrous or cartilaginous versions of these? So let us see. Let's take a look. Okay? Let's do that. Let's talk sutures. Sutures are immovable and they're fibrous. I see this beautiful suture right here. Dun, 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 dun. Nice sutural bones in there. You should be able to tell me what suture this is. You should be shouting it out right now. Top of your lungs. You should be yelling. Hopefully I gave you enough time to yell that that right there is the lambdoidal suture. One of my favorite sutures of them all. The lambdoidal suture. Got another suture right here. Sutures are immovable, and fibrous. This, of course, is the... I'm leaving that pause for you. I even gave you the first letter. You shouted it out, I'm sure. It is the sagittal suture. Now, why have immovable joints? Well, if it doesn't move, it is going to be strong. These sutures are protecting our brain. We don't want any movement because movement would create weakness and that would not be as protective. So, we're sacrificing movement for stability. And we'll do the flip side of that. We'll sacrifice stability for movement later on. So, these are sutures. And by the way, the fact that they're fibrous, they're immovable and fibrous, the fibrosity also lends to their strength. If you have collagen stitching the two bones together, it's going to be incredibly strong. All right. We got to add one quick little thing, though, about these sutures. Oh, I forgot. I got this side skull here. You should be able to find a suture here. Or two sutures here that we did not mention on the previous slide. So shout it out. Scream at your computer. Make the person in the next room wonder, what the heck are they doing? Name that suture right there for me. All right, you got it. It is the coronal suture. And let's name this guy right here. Who's that guy? Yell it out. That is you got it, the squamous suture. All right. Fantastic. What you should do right now, by the way, is pause this. Identify everything you can see on this temporal bone. Find your greater wing and your pterygoids of your sphenoid bone. Find your zygomatic bone and its pieces. Yeah, find all that stuff. Pause it. Take advantage here. Okay? All right, one more thing to talk about with regard to sutures is that they weren't always sutures. You may be aware of this. If you have ever poked a baby's skull, and I mean poke in the gentlest sort of way, okay? You know that the baby's skull has soft spots. So the sutures don't actually form immediately. If the sutures formed immediately, if they form too early, there will not be enough time for brain development. We don't make the sutures until we start to give our brains time to develop, all right? So instead, there's just membranes between these bones, and there's some big gaps where the membrane is pretty apparent, and you can feel a pulse there oftentimes, or you can see it kind of like sink in if baby's dehydrated, especially the one on the top of the head right there. So these are called fontanelles. Someone thought they were like little fountains because you could see and feel the pulse there. So there are a bunch of them. Some of the major ones are listed down here, and you can see a couple of them close in a matter of months, but then some of them take up to 3 years to actually get those bones together. So, pretty amazing. All right, let's keep going. And let's do another immovable joint. Sutures were immovable joints that are stitched together by fibers. All right. And now we have Syncrondroses. That's the plural. To make it a singular, you just cut out that E at the end there. So if we get rid of that E and we turn it into an I, there we go. A syncondrosis is an immovable cartilaginous joint. Example is the first sternocostal joint, okay? So this rib joint here, first rib, and the manubrium of the sternum right there, that joint right there is immovable, and it has hyaline cartilage in it. It is cartilaginous. So you don't really, I know you think about your ribs as moving when you expand your thoracic cage, when you take that big, deep breath in. And, well, this is one immovable joint that we've got here, okay? Syn, S-Y-N, means together. Like, for example, if you're synthesizing, you're putting ideas together, right? Syncondrosis, together with cartilage. Chondro means cartilage. Remember, we had chondroblasts and chondrocytes, etc. All right, cool. That's pretty much it for our immobile joints. Let's do a slightly mobile joint. One slightly mobile joint we've got is called a syndesmosis. Again, desmoses would be plural. Desmosis would be singular. Syndesmosis means anchored together, chained together, really. Chained more than anchored. So something is chained together. Well, if you're chained together, you're still going to have a degree of movement, right? I mean, if the dog is on a chain, it can move a little bit, depending on how long the chain is. It's not like totally immobile. You find this joint distally between your fibula, your lateral leg bone, and your tibia. All right? Your distal tibiofibular joint. Have you ever turned your ankle? You ever rolled your ankle and sprained it that way? What you might have done is stretched too much some of these ligamentous bands here. And a ligament like this is made out of what? It's made out of collagen fibers. So this is fibrous. So slightly movable, fibrous joint, syndesmosis. Now, if we find a joint like this in the distal leg, so right near the ankle, make a logical guess. If we find something near the ankle, where else will we probably find it? Think about that for a second. Did you say near the wrist? I hope you did. Because we also have this distal joint between our radius and our ulna. So this distal radial ulnar joint. We can see all the connective tissue, all the collagen linking these guys together. And you actually use this joint every time you are flipping your hand over. So if you're going from palm up, notice that the two bones of your forearm, your radius and your ulna, are parallel to one another. But then when you rotate your hand, you spin your hand to go palms down, you actually make an X with them, and there's a little bit of movement right here. Not a ton of movement. I mean, do this for yourself, and you'll see it's not like a crazy big movement you got going on here, but it is enough. And this is another example of a syndesmosis, which is a slightly movable fibrous joint. All right, good. Let's get rid of all these stuff here. Do me a favor. You should totally pause this. You should absolutely pause this. And you should tell me what this bump is, what this hourglassy thing is, what this ball is, what this bump is, what that bump is, what that is, bump and bump here. You should do all those things. Pause this and point those things out. Okay? You should totally do that. If you don't know them, then take a moment, pull your lab manual out and look them up. And take a moment to get them in your brain. All right. Now we got a slightly movable cartilaginous joint. We've actually seen one of these already. The joint between the two vertebral bodies is a slightly movable cartilaginous joint. It's cartilaginous because we got that fibrocartilage right there, and it is slightly movable. When you bend, think about your spine moving. You've got a lot of bones there. So you're just doing a little bit of motion over at each joint, but overall that can translate to a fair amount of motion. So, slightly movable cartilaginous joint is called a symphysis. These ones between your bodies of your vertebrae, each of them is called a vertebral symphysis. Symphysis means growing together. I'm not sure how to relate that to give you like a good, way to tie the etymology in with the function here. Yeah. Let's keep going. Because there's another one of these. Right there. The anterior joint between the two hip bones. It is called the pubic symphysis. So it's called the pubic. The two bones there, each of them is a pubic bone. Which is now, if you're an adult, it's part of your hip bone. And the joint between the two hip bones in the front is called the pubic symphysis. It is also made of fibrocartilage. It is also a slightly movable cartilaginous joint. So it is a symphysis. This one moves a little bit when you are pooping. Moves a little bit more when you are giving birth. All right. Actually, you know what? It doesn't really move when you're pooping. I'm thinking of the sacrococcygeal joint. Why do I have the sacrococcygeal joint on my mind? One of life's great questions. All right. I really should write down a script for these lectures, don't you think? Nah. It's better without a script. If there was a script, I wouldn't do this right now, what I'm doing here. Which is losing my train of thought. All right, where was I? These are the two symphyses, one between your vertebrae, between the bodies, and also one between your two hip bones in the front. Both your symphyses, both categories of symphyses here, have fibrocartilage as the connector between the bones. We see some fibrocartilage right down here. It is very pink because it has a lot of parallel collagen, which makes it really, really, really strong. All right. Yeah, during pregnancy, hormones actually make the pubic symphysis get even more lax. It makes it get looser and looser to make giving birth maybe a little bit easier. Yeah. Okay. Good stuff. Done, except for one more category of joint. And this is the category that we're going to do for the rest of this lecture and the next one. I'm going to break the joints up into two lectures here. Synovial joints, like your glenohumeral joint, aka your shoulder joint, like your acetabulocoxal joint, aka your hip joint. Synovial joints are freely movable. Remember, synovial joints had synovial fluid. Why would you want fluid between your bones if not for lubrication? So we're going to look at some synovial joints and spend some serious time with them. Let's do it. Let's start with some basic characteristics. 1, 2, 3, 4, 5, 6, 7 basic characteristics of synovial joints.
They have articular cartilage. There is a joint cavity. There is an articular capsule. There is synovial fluid, reinforcing ligaments, vascularization, and innervation. Those are my characteristics. All right. I see a synovial joint right here. Do you guys want an extra credit question? I want you to tell me whether this picture right here is from a child or an adult, and you have to give me 2 reasons to get it right. Two reasons why you know. Is this a kid or is this a grown-up? And I need 2 separate, different reasons, okay? Email me that before the next full moon, and you'll get some extra credit. All right. Let's keep going. Okay, on the joint surfaces. So right here where this blue is, on the joint surfaces, we have articular cartilage. Articular cartilage is made of hyaline cartilage. It has more water than bone, so it is more flexible and squishable than bone. It acts as a beautiful shock absorber. So we're going to have articular cartilage to take some damage. Hopefully not too much though, okay? All right. Let's keep going. There's a space between the bones. That space is called the joint cavity. It is going to involve the next 2 things we're going to talk about, because this cavity has to have a covering, and the covering is called the articular capsule. And this cavity has to hold something, and the thing this cavity holds is called the synovial fluid. Okay, let's talk about that capsule. The capsule covers the joint. It would be around the whole thing, as we see with this guy here. It's going to cover the joint. It's going to surround the joint. It's going to enclose that joint cavity. And there are actually 2 parts to the articular capsule. 2 parts to it. There's an outer part called the fibrous capsule. So the outer part is the fibrous capsule, like the bluish part here. It is made of dense, irregular connective tissue, and it is going to be continuous with the periosteum of the bone on both sides, so continuous with all the periostea. And this is going to help give the joint some strength, because if it's a mobile joint, we do need some strength. The capsule will help. Now, the inside of it is called the synovial membrane. So that purple part in this drawing here. Take a wild guess. What do you think the synovial membrane is going to make? Let's take a guess. Take a stab. If you said synovial fluid, then you are totally correct. Round of applause for you. Synovial fluid is made by the synovial membrane, which is the inner part of the articular capsule. Now, capillaries in this membrane are going to basically allow fluid to be pushed out from the bloodstream, and that what was once blood becomes synovial fluid. It is going to be the oil of your joint. Why do we use oil? It is a lubricant, so we're going to have a lubricative function for our synovial fluid. Plus, synovial fluid acts as like a suspension fluid, what you would put in your shocks. You want to be able to absorb impacts. Think about running. I mean, you're running. Think about the force you have to absorb in your joints. It's amazing. It's absolutely amazing. And your synovial fluid helps you absorb that shock. Plus, it moves things that feed the various cells and structures within this joint. Okay, one quick thing. Let's say after this lecture, you were going to go out and do a quick little a quick little run. You're going to go out and run a mile as fast as you can. So after this lecture, after you're done working your mind, you're going to go work your body a little bit. You're going to run a mile as fast as you can. All right? Would it be smart to just get up out of that chair, go outside, and boom, take off? Hit the GPS button on your watch, if you have a GPS watch, and then boom, you're off, okay? Are you going to do that? No. Hopefully not. You're going to warm up. Maybe you're going to jog a little bit first. You're going to walk a little bit, you're going to jog a little bit, maybe jog a slow mile, maybe do some strides a little bit. And one of the benefits to warming up is you are going to make more synovial fluid. You can see why that's good, right? More synovial fluid, more lubrication, more shock absorption. Your synovial fluid also actually gets less viscous. That is a good word. You guys know that word, viscous? Viscous is basically like how thick a liquid is. If something is less viscous, it flows better. And you want good flow within your joints. So that's one of the joint-related benefits to warming up. There's muscular and neural benefits to warming up as well. So don't skimp on that. All right. Anywho, let's keep going. What else we got? Ligaments. Good old ligaments. Ligaments are going to help anchor bone to bone. They're especially crucial for synovial joints because we have so much motion. Ligaments are going to strengthen the joint and help restrict the motion. You don't want the motion to be too crazy because then you would utterly sacrifice stability. We're looking at a sagittal view, there we go, of the knee. And we can see a pair of joints crisscrossing in the joint cavity here. These crisscrossing joints, because they crisscross, they are known as cruciate ligaments. Think about words like crucifix, for example. And there's one that starts on the back of the femur, that is going to be called the posterior cruciate ligament, and one that starts in the front that is called the anterior cruciate ligament. You probably heard of the ACL, right? Now, ligaments are great because they're super strong. They're super strong because they have all this parallel collagen fibers. But problem arises when you stress ligaments at the wrong angle. So this ligament that I've got pictured in the screen here is really strong in this vertical position here, okay? But if it were stressed horizontally, if stressed this way, it could tear. And that can happen with the ACL or the PCL. By the way, we're going to learn these ligaments in the lower limb lab that we're doing for the skeletal system, which is why I'm mentioning them now. And oh yeah, there's some other knee ligaments we got to know for lab. There's a ligament on the tibia side called the tibial collateral. There's one on the fibular side called the fibular collateral ligament. And there's even one right here called the patellar ligament. I don't know why I didn't label that one. I'll do it right now. That is called the patellar ligament. So we're going to have to know these 6 ligaments for lab. All right. Cool. What else do we got? Blood vessels, nerves. These are our last things about synovial joints, our last common characteristics. These joints need good vascularity. So a lot of blood vessels. Vascularity is necessary to make synovial fluid and to feed the variety of structures. So we need good vascularity. Plus, we need good innervation. We need good innervation. We need a lot of sensory nerves coming out of our joints. Let me ask you a deceptive question here. Do you know what your joints are doing? Like, you close your eyes right now. Do you know if your elbow is straight or bent? You absolutely do. You totally, totally do. You have this sense of joint position, this sense of limb awareness. It is called proprioception. It's like your sense of belonging almost. This is your sense of limb and joint position, of limb awareness. Are you a gymnast? If you're a gymnast, you probably have fantastic proprioception. Proprioception is really important for balance. So, if you strike a yoga pose like this gentleman is right here, like, what is this, like a tree pose or something? I don't know. Close your eyes, hold that pose. Can you do it? If you can do it, that means you are using your proprioceptive skills. Okay? The nerves in your joints let your brain know, hey, this is the position of your joint. This is crucial for movement and crucial for balance. By the way, guess what happens in the elderly? Guess what happens to their proprioceptive ability? You got it. It's going to decrease. It's going to go down, which is why they are more likely to experience falls, and falls are not good. Falls are not good when you are old. Can you mitigate that loss of proprioception? Yes. With exercise, with training, you can mitigate that loss. So do that. All right. Awesome. This is so good. All right, guys, I'm going to pause right here. This is going to be the end of the first joints lecture. I will see you next time for the next one. Bye-bye.